everybody. Thank you for joining our webinar on preparing for the 2017 NOFA. My name is Anna Blasco, and I am a technical assistance specialist at the National Alliance to End Homelessness. I'm going to just get us started here, and then I'll hand it over in a little bit to the director of the Center for Capacity Building, Cynthia Nagendra. Just before we get started, the usual reminders. You're on mute, but we do want to hear from you, so please make sure that you type in questions whenever they occur to you in the questions box. We'll try to get to as many as we can, but I'll go ahead and answer one now that I know is on your mind. Yes, this webinar is being recorded, and we'll post it as soon as possible at our website, which is endhomelessness.org. Okay, so a little bit about who we are. The National Alliance to End Homelessness is a nonprofit organization. We do work on the Hill, we do research, and then my department, the Center for Capacity Building, does training and technical assistance focusing on strategic, cost-effective, data-driven solutions. But what you really need to know for the purposes of today's webinar is that we're not the U.S. Department of Housing and Urban Development, which is, I think, oftentimes people think we know things that you don't know about the NOFA, or we have some insider information, and that's just simply not the case. I'm hearing that there's some background information here, or background noise, so if my colleagues on the webinar could mute themselves. I'm seeing that there's a little bit of background noise and people having trouble hearing us, so that would be helpful. Yeah, so we're not HUD, so we don't know anything that you don't know about the NOFA, and there's a lot we still don't know about what it's going to entail. We'll cover a little bit today what we do and don't know, but we just want to be super clear that we're a nonprofit organization. We don't receive any funds from the federal government. We're really here to talk about best practices with completing the NOFA rather than trying to give you guys some information that you can't already get that's publicly available. So what is the point of today's webinar? We know that the Continuum of Care NOFA can be really, really hectic for people. So we wanted to take a step back from all of that and look at how to use the NOFA process as an opportunity to think about the bigger picture. So we'll include tips today for using the NOFA to make strategic, data-driven decisions that will improve your system's response to homelessness, as well as an approach for deciding which interventions will best meet your community's needs. So just what the agenda looks like today, we're going to briefly touch on what we do and do not know about the 2007 Continuum of Care NOFA. Then we're going to zoom out and look at the bigger picture and talk about how to figure out what your community needs to end homelessness and how you can use the NOFA process to get closer to achieving your goals. We'll touch on the new project component, the Transitional Housing-Rapid Re-Housing joint component, and talk about how to use it strategically. We'll also talk about what to expect from the Alliance during the competition. Okay, so I have a quick poll here just to check in with you guys. Let me launch that for you. So I want to know, oh, can you guys see this poll? It says 0% people voted. Okay, people are voting. That's good. So I want to know, is the Continuum of Care NOFA process in your community always a last-minute scramble to get things done? Is it a crapshoot where you never really know why you scored the way you do? Is it a tool you use to improve your response to homelessness, or a battleground with everyone staking out sides? Or is it a little bit of all of the above? So it looks like only half of folks have filled out the poll, so I'm going to keep it open for just a couple more seconds. So please make sure to check in here and let us know. Okay, looks like almost everyone has filled out the poll. Okay, I'll share the results with you guys now. So it looks about 38% of you said all of the above, 40% said it's a tool that you use to improve your response to homelessness, and some of you said, last minute scramble, a crapshoot, and a battleground. So yeah, that makes total sense. We definitely have heard that this can be a challenge. I'm happy to hear so many folks are using this strategically. So one thing that I think we don't do often enough is tell you just some of the acronyms we're going to be using today. If I said Continuum of Care Notice of Funding Availability, this webinar would take much longer, so we're going to use some acronyms instead. So COC is the Continuum of Care program. We also use COC as a shorthand sort of for the body that manages homelessness in your community and sort of oversees the funding decisions that are part of the Continuum of Care program. The NOFA is the Notice of Funding Availability for the Continuum of Care program. The RRH is Rapid Rehousing. We're using RRH.TH to signify the new joint component that is Rapid Rehousing and Transitional Housing that we'll talk about in a minute. PSH is Permanent Supportive Housing, and CH is Chronic Homelessness. So if you see those acronyms, this is what they mean. Okay, so here are two of those acronyms right here. What's new with the Continuum of Care NOFA for the 2017 competition? So first off, Congress hasn't yet appropriated funds for the Continuum of Care program. So the amount of renewal funds each COC can apply for, or what's called the preliminary pro rata need, COC planning dollars and UFA costs are not yet available. We don't know how much money is going to be available. HUD's going to provide this information once the fiscal year 2017 funds have been appropriated. This is just a good time to remind everyone that HUD does not decide how much money to invest in the Continuum of Care program. Congress does. So that's why it's so important that everybody gets involved in advocacy and letting their Congress people know how important it is to fund homelessness programs. But that aside, the registration notice provides information necessary to register continuums of care, as well as some basic information about this year's application, including what new projects can apply for, which we'll get to in a little bit. We don't know when the NOFA is being released, but we expect it should be soon. So the registration notice gives us a little bit of information. It's mostly the same as last year's, and it focuses heavily on HMIS data and system performance measures. As in past years, COCs are going to have to prioritize projects into tiers, with projects prioritized in Tier 1 being more likely to be funded than projects in Tier 2. And you're expected to have a performance-based review and rank process. Now that we've touched on some of the details, let's take a step back and remember the big picture of what you're ultimately trying to achieve. Your community should have a vision for ending homelessness that is year-round. The NOFA is just one of many tools that continuums of care have to enact their plan and achieve that vision, because it gives you the opportunity to change and reallocate projects based on performance. The added bonus here is that a planful process will actually help make the NOFA process much less haphazard and much more strategic. So this language comes directly out of the 2017 registration notice. And it states that HUD expects communities to use cost, performance, and outcome data to improve how their resources are being utilized to end homelessness. So it doesn't just say continuum of care resources, it says resources. So I think it's pretty clear that HUD expects communities to be looking beyond continuum of care funds and what points are available for what, but rather to be thinking about what's necessary to reduce and ultimately end homelessness in their communities. Okay, so now I'm going to turn it over to Cynthia, who's going to talk about outcomes.
Hi, everybody. So as Anna was saying, we know that the NOFA process is yet to be kind of finalized from HUD. So, again, whatever we say here are, what we know from the registration notice and really how we kind of recommend that you approach this whole. And I also know that the NOFA might feel like 2 or 3 months of time or more that you have to be away from the actual work that you're doing of ending homelessness in your community. And having written NOFAs, I completely understand how incredibly stressful and hectic this time is for every COC. But though there is a lot to do to complete the application and prepare for it, it's really, many communities can attest to the notion that the NOFA can and should actually be a helpful part of the work of ending homelessness, and that's because of the opportunity it gives you to make strategic decisions that change and improve your system's response to homelessness. So how do you approach NOFA as an opportunity to change your system for the better? Well, let's start by focusing on outcomes. To make homelessness rare, brief, and non-recurring, some important outcomes to focus on are reducing the number of people experiencing homelessness in your community. And communities with a high unsheltered population should really prioritize reducing unsheltered homelessness, particularly for single adults. When we look at the data of who is making up a lot of unsheltered homelessness, it's a significant portion of the unsheltered population in most communities are single adults, and many communities just don't have enough low barrier and housing focused resources for the population. So it's really important to kind of think about that when you're thinking about what interventions your system needs. Another outcome is to reduce the length of time people experience homelessness. We know that the longer people are homeless, the worse, more likely they are to stay in homelessness, and the worse it is for them, harder to exit. So we want to reduce the length of time people experience homelessness and make it really brief. We also want to increase exits from the homelessness system to permanent housing. So what decisions can you make to meet these outcomes? How do the interventions you currently have impact these outcomes? These are the outcomes that should guide your vision to reduce homelessness. Now, there are other outcomes your system might be looking at. I know you're also looking at system performance measures. We just wanted to focus on these particular ones today. So to help achieve these outcomes, ask if your current projects have the capacity to meet them. And so when you're thinking about what you're going to be doing through your NOFA process and what your projects should look like and how you're going to tier them, one thing to really connect all of that to is whether your projects are meeting, are helping you to really reduce homelessness. Are projects in your COC aligned with housing first practices? That is, are they all low barrier with free prerequisites to get in? And do they have a focus on getting people into permanent housing? How does your community prioritize the most vulnerable people in your community? And are your projects serving the people who need the most help in exiting homelessness? And do you have a written process? Your coordinated entry system clearly plays into this. But your projects also play an important part in this. Do you have enough rapid rehousing? We know rapid rehousing is a really important tool in your sort of bag of interventions that you want to be able to have enough of so that you can help people exit homelessness quickly. Do you have enough crisis or shelter beds? Now that's a nuanced and kind of complicated question, and I'll come back to that in a little bit. Is transitional housing being used for the people who need it the most? Which projects are performing well on these outcomes and which ones are not? And which ones are the most cost effective? For example, what does it cost per permanent housing exit in each of these different projects? So these are all some questions to ask as you evaluate what interventions your system needs, and we're going to talk more about that. So once you have outcomes to focus on, what interventions does your community need to meet those outcomes? So to know what you need, during the year leading up to the NOFA, COCs are required to do a gaps analysis annually. Now, if you haven't done one, you can take a look at the data you have now to determine need. So hopefully you have a gaps analysis, hopefully you've done that process, but again, you can look at data that you have now to figure this out. So this is not a wish list of things you think your community needs. In other words, sometimes a gaps analysis can be kind of, people do a survey and they try to sort of say, well, I think we need more of this and I think we need more of that. But really, it should really be, and it just, a way to sort of scale up projects that you already have, but you should really use data and project performance on the outcomes we just mentioned to drive decisions about what your community needs. You should utilize your PIT data, your HIC data, which you all just submitted into HDX, an evaluation of project performance, which you may have already done or about to embark upon, and really try to include meaningful consumer input to determine your community's specific needs. This data-informed process should really result in a plan, as Anna had mentioned, for what mix of interventions are needed to end homelessness in your community that guide your NOFA decisions. So in other words, your gaps analysis should evaluate if the community's portfolio of projects really aligns with what your community needs for those interventions. And if this is done well, this process results in a community-wide understanding of where the COC is heading, right? So it's not a surprise at NOFA time about which decisions you need to make. It's been kind of considered, and you have a plan to move ahead. And this plan may not result in consensus. Often it does not. And it often requires COC boards and other policymakers to make really difficult decisions about what changes are needed to improve these outcomes. But if you have a plan that you're sticking to that is really data-driven and focused on outcomes, the decisions just become more transparent and fair, and people sort of understand why things are headed the way they are. That's why this is one of the biggest opportunities that the NOFA offers you, because you're able to sort of make these big changes.
Okay, so now that we know what outcomes and criteria we're using to measure our success at reducing homelessness, and we know how to measure our progress, how do we evaluate what we need to get to the finish line? And I know I see a question in here about what tools should people be using for the gaps analysis, and we can address that a little bit more in the Q&A, but just hang on tight because I'm about to get there. So how do you determine whether you have the right mix of projects to meet the needs of households in your community? So there's a supply and demand here, right? You have to look at the supply of projects you've got and the demand on those projects from people experiencing homelessness who need help in your community. So here's a couple things that you might look at. On the left, we have a bunch of different criteria that make up your homelessness portfolio. The project type, so transitional, rapid rehousing, et cetera. The target population of these interventions, the geographic location, which is important particularly for large COCs or balances of state COCs where transportation is not a thing. The occupancy rate, if they have screening criteria that screens out people with more housing barriers, their length of stay, how successful they are at moving people into permanent housing, their efficiency or cost effectiveness, and what types of funding sources can typically pay for those services. So that's our supply side. On the demand side, who needs help in our community? So you can look at population type, families versus individuals, unaccompanied youth, survivors of domestic violence, veterans, people with disabilities, et cetera. Again, their geographic location, right? Where is the need in your community? And how are you prioritizing people based off of their vulnerability? So there's a lot of stuff on this slide, and we could probably talk at length about how to evaluate each one of these things and which data sources to use. But we're trying to keep this pretty simple and straightforward. So I'm going to give you a quick, simple example of the fictional Arkham Continuum of Care. And our quick look at their housing inventory chart, or HIC, and their point-in-time count, or PIT. So again, on the left, you see their homelessness projects. So we know in Arkham, their Continuum of Care funding is heavily invested in permanent supportive housing for families, which is the blue here. In Arkham, the outcomes of their permanent supportive housing are pretty high. 98% of people either exit from or retain permanent supportive housing or permanent housing. So we know most of the PSH beds are targeted towards families. But when we look at the point-in-time count, so the people experiencing homelessness as counted in our annual snapshot, we see that most people experiencing homelessness in Arkham are actually single adults. There's no chronically homeless families in Arkham, and there's also no unsheltered families in Arkham. In the last point in time count, it looks like they also counted about 5 unaccompanied youth in their point in time count, which is that little green bar. So just a rough snapshot of a fictional COC's portfolio and what their needs are in their community and how they're aligned. So keep this in mind because we're going to keep talking about it. So some things Arkham may want to think about. Does the community's number of permanent supportive housing units for families match their need? No, as we've just discussed. There's no chronically homeless or unsheltered families. So it looks like we have way too many permanent supportive housing beds for families. So some things to think about. What's the capacity of the family permanent supportive housing provider to serve chronically homeless single adults? How are we prioritizing unsheltered chronic households in Arkham for this very expensive, limited resource? Does Arkham have enough crisis beds for unsheltered single adults? If I flip back, it looks like we have a good amount of unsheltered individuals, and we have a lot of transitional housing and emergency shelter targeted towards individuals, yet people are still outside. Are there enough rapid rehousing units to match the need of sheltered and unsheltered people? If you recall, rapid rehousing was pretty minimal in Arkham, so we don't really have a lot of that. And who is the transitional housing targeting, and does it match the needs of the people who need it the most? So those are just the kinds of things that, just by looking at this data, the hick and the pit, that might spur conversations in your community. So we're going to come back to that example in a second. But right now, let's talk about what opportunities the NOFA gives your continuum of care. Okay, so the NOFA provides you with basically two main tools to improve outcomes in your system and align projects with your community's needs. Those are reallocation and the review and rank process. So just a quick definition of reallocation, because I know this is confusing. Reallocation is a process to move funds from renewal projects to create one or more new projects. You might consider reallocating because a project doesn't match the community's needs, as we've discussed. The project performs poorly on key outcomes, as we've also just talked about. And also, maybe the project is consistently sending money back to HUD. They're not doing a good job of utilizing all of their funds. That might also be another reason to consider reallocation. So we know in the 2017 NOFA, based on the registration notice, what continuums of care can reallocate to. And these all look pretty similar except for the one in that nice teal color. So that's permanent supportive housing for chronically homeless individuals and families, including youth, rapid rehousing for individuals and families, including youth. There's this joint transitional housing and rapid rehousing component, which Cynthia will talk about in a second, HMIS, and supportive services only for coordinated assessment. There's also a potential bonus project. As I said before, HUD doesn't know how much money they're going to have because Congress hasn't appropriated it yet. So there may or may not be a bonus. HUD has said if there is one, depending on the funding that's available, this is what the bonus funds will be able to be used for, or what continuums of care will be able to apply. So again, it's pretty similar: permanent supportive housing for chronically homeless individuals and families, including youth, new rapid rehousing for individuals, families, and youth entering directly from the streets, or persons fleeing domestic violence or other dangerous situations as categorized in Category 4 of the homeless definition. The joint TH-RRH, whatever you want to call it, component, which combines transitional housing and permanent housing, rapid rehousing into a single project to serve individuals and families experiencing homelessness. Okay, so I'm going to turn it over to Cynthia to tell us a little bit more about that joint component.
Thanks, Anna. So as Anna said, we will be talking more about this joint component in an upcoming webinar, but we wanted to spend a few minutes talking about this new component now. Now, again, we are not HUD. We don't have any more information that you got in the registration notice. And we know that HUD will likely provide more details in the NOFA. I know there's a lot of questions about how to operationalize this and how it's actually going to how it will be transitioned and how new products will work. So that will hopefully all happen when the NOFA is released, and so please stay tuned for that about how it will actually work. But what we know now from the registration notice is that the new TH-RRH component is a new component that combines transitional housing and permanent housing, rapid rehousing, into a single project to serve individuals and families experiencing homelessness. So there is the project's going to have the capability of doing both. We'll talk more about that in a second. The TH-RRH joint component provides some really interesting and important opportunities, we think, to fill some gaps in your system. So, we've talked about outcomes and what your needs are, and sort of trying to gauge where there are places that you could use more resources. So this new component can provide low barrier temporary housing, that's the TH part, while individuals and households are moving quickly to permanent housing. It's still 2 years in total, right? So it's going to sort of have to be, it's not like you could spend 2 years in one component and more time in the next. In total, you're spending 2 years in this component. And what we think is that this provides sort of a really great opportunity for transitional housing projects and all other projects, but particularly for transitional housing projects, to potentially reallocate their funds to this new component. So TH projects could reallocate to TH-RRH projects that, for the first time, can give them the ability to serve people in temporary housing that need it, as well as provide those clients with a permanent housing exit with rapid rehousing dollars. So that's a pretty exciting thing. So this can be, you're still sort of able to serve people who need transitional housing or temporary housing for a period of time, but be able to help them exit with permanent housing, rapid rehousing dollars. This new component can also provide a really useful opportunity to create more crisis temporary housing in your system. A lot of communities, feel like they don't have enough shelter capacity and don't recommend building new shelter, but this might be something that you can use as crisis beds and exit people to permanent housing really quickly with rapid rehousing assistance. So one thing to really notice, people don't have to stay in the temporary housing for long periods of time, and they really shouldn't. The TH-RRH component should be considered alongside the system performance measure of the average length of homelessness, right? And we're always trying to decrease the average length of homelessness across our system. So on average, people might still have shorter stays in this type of transitional housing, rapid rehousing, unless they choose to have longer stays. So some people might choose to stay longer or need a little bit longer, but they're still able to exit to permanent housing with the rapid rehousing dollars. And like any of the projects in your system, it should be choice driven. So clients should choose how long they want to be temporarily housed in the temporary part of the project before they are rapidly rehoused. And you shouldn't have different eligibility criteria, right? So you can't have different eligibility criteria for the temporary housing part and different eligibility criteria for the rapid rehousing part. It has to be the same eligibility criteria to get in, and the project needs to be able to serve both. Now, people don't have to go to the transitional housing component to get to the rapid rehousing component. You can go straight to rapid rehousing, but for people who might need some time while you're trying to help them find housing through rapid rehousing, this could be a good place for them to stay while they are, trying to get housed. So transitional housing and rapid rehousing program, this TH-RRH component can offer different supports depending on the population served. So if you're serving survivors of domestic violence, for example, there might be different safety concerns. If you're serving youth, there might be different supports. But you are also thinking maybe of using this for your unsheltered single adult population. There might be some other things that you would think about in your program there. However, it's basically, all the best practices you use in rapid rehousing. So what models should be implemented? What is this supposed to look like? So as I said before, we are going to go into much more detail because this is kind of a nuanced discussion, and we don't want to just kind of, we don't want to miss anything, and so we want to spend more time on this, and we want to really talk about especially how this provides opportunities for survivors of domestic violence, for youth, for unsheltered people experiencing homelessness. And so we're going to talk about that more in an upcoming webinar. Hopefully we will also know more from the NOFA if it has been released. And so what we think, we've been talking to a lot of communities, and communities that are excited about this kind of already, and you might be one of those communities, you might have a model that basically operates like this, right, where you're sort of you have some crisis beds and you're quickly exiting people's permanent housing. A lot of GPD programs are now operating this way or have applied to operate this way because of the changes in GPD. So this might be something you're already doing and that you want more of. If you're a community that has a model like this that you think is working really well, we would love to hear about it. What we want to do in the next webinar and in the upcoming weeks is collect some good examples of how this works. We've heard from different communities that they're doing this, that they think it works really well. We want them to sort of present their model so that people have a good understanding of how to design an effective TH-RRH component and see how it works. It might not be called that because this is a new, newfangled component that HUD is putting out there, but it's basically operating this way. So if you have this kind of component, you think it's working well, please let us know. So back to reallocation. Reallocation is, as Anna mentioned, a really important tool you can use to help scale up interventions that work well, and also further progress on system outcomes and meet the need of people experiencing homelessness in their community. So this is how you really can sort of affect changes in all the areas that we just talked about. One thing to, here are a few things to note about reallocation. Reallocation can be voluntary or involuntary, meaning projects can voluntarily reallocate without going through a new whole project review process. This is really how, it depends on how you set up your system and your NOFA process. But you can be a project that decides, actually I haven't, I want to try to reallocate at least part or whole project, and we don't need as much as we don't have enough, we're not utilizing all the capacity, or we want to try adding some rapid rehousing or something like that. And communities can prioritize projects that voluntarily reallocate to receive new project funding. So if you're, for example, a transitional housing component project, and you're saying, okay, I'll voluntarily reallocate to this new TH-RRH, your COC can set up the process as, okay, if you voluntarily reallocate, we'll prioritize you for the new project, and you can be the one to sort of get that new project money, and we can put you to tier 1, or we can figure out how to make sure that it comes back to you in some way. Now, that again is up to how your local COC wants to run this process. Involuntary reallocation happens after a neutral decision-making body conducts an objective, performance-based review and rank process of project's performance. We'll talk about that more in a minute. And it's important to remember that projects can reallocate part of their project or the whole project. The review and rank process, the process your community uses to evaluate end-tier projects based on objective performance criteria, is a great way to communicate the community's priorities. Hopefully you've planned your priorities through this planful process we've talked about. You've used data to figure out where you need to head. Incentivize providers to improve performance or adapt best practices, because you are incentivizing projects through your review and rank scoring tool and process to do well on the outcomes we talked about, and whatever outcomes your community is trying to achieve. So this incentivizes providers to improve their performance so that they rank higher. And it also helps you objectively evaluate which projects are helping your community reduce homelessness. And you don't have to wait, and you probably shouldn't wait until the NOFA drops for this to happen, though I know that often is what happens. But this is a way to really do this sort of annual evaluation of how your projects are performing. And there's different ways to weight your scoring tool. I know a lot of people ask questions about, well, what scoring tool should we use? We saw on HUD's website that a scoring tool may be coming. We don't know what that means exactly. It might be just a suggestion on how to do a review and rank process, what objective criteria to use. The NOFA last year also did, sort of give you some examples of what objective criteria you can use to evaluate projects. But the most important part is that it's objective and performance-based, so that you are really using data to figure out which projects are performing well. And you don't want to necessarily ding projects on outcomes if they're serving, prioritizing particularly vulnerable populations. There's different ways to weight your scoring so that you don't disincentivize people from serving really high need folks. So here are some do's and don'ts in facilitating a performance-based review and rank process. And this is something also, there's a lot of great scoring tools out there, and a lot of communities have figured out how to do it as well. So a lot of people have posted these things. So, you can do some searches and see what you find out there. So when you're doing this review and rank process, do solicit input from stakeholders in the beginning. Try to do this as early as possible so that everyone kind of is on board with what's happening, or at least understands and is informed about what's happening and knows what to expect. Base the scoring tool that you create on project and system performance data. Evaluate if even high-performing projects are meeting the community need. Use entire program budgets to evaluate cost effectiveness if you can. I know it's really difficult to get entire program budgets to evaluate cost effectiveness, so you might just be working with your HUD budget, but it's possible, and if you have time, try to see really to measure cost effectiveness across program types, and within program types, it's helpful to have the whole budget. Release a draft of the scoring tool before the NOFA. So hopefully you have your scoring tool. Everyone is ready to hit the ground running with that. You might have one from last year. You might have tweaked it. You might change your priorities a little bit, but you have it. And adjust it after the NOFA is released if you need to. You can give extra points to projects that prioritize populations, as I said before, such as people who are chronically homeless, that may impact their outcomes. Establish a panel of non-conflicted and knowledgeable stakeholders to really sit on a committee that can make difficult decisions. This is not an easy job. Sometimes you are defunding projects that you have worked alongside. So it's really helpful to have some neutral, non-conflicted people on that review and rank committee, people who are able to make decisions that doesn't affect their own funding. So it's really, really important to have the right people on that committee and empower them to make the difficult decisions that they're going to have to make. Some don'ts. Don't make the process or criteria secret. Obviously, you want to make it transparent. You want everyone to know what's going on and how you arrived at that criteria in the community. Have a narrative application that takes projects up there. Don't have a narrative application that takes projects up there, right? So you don't want people to say, answer questions in a narrative way. You want projects to submit their data. Now, a lot of people are pulling data out of HMIS and looking at it that way, and projects sometimes are like, that's not my data. I'm sure a lot of you have heard that before. So it's helpful for projects to pull their own data and understand why their data is the way it is and submit that as part of their application. Don't ignore the severity of needs the client served. Vulnerability is really important to prioritize. Don't ignore efficiency and cost effectiveness. That's a really important measure. And don't release a tool after the NOFA comes out that doesn't allow for feedback or changes. You might want to make sure that that's why this is so important to have this done before the NOFA comes out. So remember the Arkham CoC that Anna just talked about. Let's kind of take a look at them again to see how reallocation of performance-based review and rank process could help them reduce homelessness and work, at least make progress. So just remember quickly that the CoC funding is almost entirely invested in permanent supportive housing. There's a little bit of rapid rehousing and transitional housing. It seems like there's quite a bit of shelter. And a lot of the permanent supportive housing is for families. It's not at capacity. We know it's being underutilized. And there aren't a lot of chronically homeless families in the community, but there are some people who are unsheltered and sheltered chronically, people who are chronically homeless. There is a significant amount of unsheltered single adults. And there's a lot of shelter for families, but not a lot of shelter for individuals or youth. So remembering all that, here are a few recommendations that it looks like Arkham might need to do. Arkham needs to prioritize their permanent supportive housing people that need it the most. So the permanent supportive housing could be better aligned with the needs. Remember, we talked about how to align community needs with the project. Could be better aligned with the needs of people experiencing chronic homelessness by prioritizing the most vulnerable, people that need it the most. And Arkham can accomplish this possibly by incentivizing this in the NOFA review and rank scoring process by giving additional points to permanent supportive housing projects that target the population that needs it the most, which may be individuals, not families. Now you can change, this can be a grant amendment that you just change the people you're serving. It depends on how your permanent supportive is set up. Arkham needs to increase exits to permanent housing and add more options for individuals, right? So Arkham should consider reallocating from projects that are not meeting the need to rapid rehousing for individuals and families. And that could really sort of add some permanent housing capacity, create some flow through your system. Looks like Arkham should consider reallocating from a lower performing permanent supportive housing project to a higher performing one. We do have a tool that is on our website, and I think you can also download it here, that sort of talks about how to evaluate your PSH. And Arkham should consider cost effectiveness and vulnerability of clients as well as utilization. So are the projects full? Why or why not? How hard to get into the project? So the CoC could also consider reallocating either in whole or in part from low-performing, inefficient, or underutilized PSH to create more rapid rehousing. Rapid rehousing, again, might be a really helpful way to sort of create some flow through the system and exit more people to housing. Next, oh, sorry, so One thing I want to talk about here is, and again, this is a nuanced conversation, and we can't sort of really get that deeply into it on a webinar, so I'm just going to mention a few important things. As you can see, that the Arkham CoC may need some crisis beds for people who are unsheltered, right? We don't want people on the street, but there's a lot of things to consider when you're looking at something like that. So one thing you could consider here is Arkham could consider the new TH-RRH component. They could consider reallocating TH to TH-RRH or creating new TH-RRH from other funds to build capacity for crisis housing for people experiencing unsheltered homelessness that gives them a rapid rehousing exit when they choose to move to permanent housing. It doesn't just have to be for unsheltered folks, but because they sort of have a high unsheltered population with single adults, it might be a good way to help those folks out and get them into housing. But a really important note here, if you have people who are unsheltered and your shelter beds are full, which is a lot of communities we know, we recommend that you consider a number of other options before you build any emergency shelter beds. So that's different than the TH-RRH component, but we just want to mention that you don't just look at your unsheltered population and think, okay, we need to build a bunch of emergency shelter right now. That's pretty much how, I know that that's probably a pretty familiar recommendation. So some questions to ask: is your emergency shelter low barrier and housing focused? Or are people unable to get in because of too many rules? We are talking about this a lot in our other webinar series on emergency shelters, so if you're interested in that, tune into that. Are the shelters able to connect people to current housing options once they are there, or are people getting stuck there? Look at these issues before considering crisis beds. The Transitional Housing-Rapid Re-Housing component could, though, be a great way to add some crisis capacity without building new emergency shelter beds and still get rapid rehousing dollars into your system. And we can see Arkham didn't have a lot of permanent housing options for single adults. This could be a great way to get some rapid rehousing dollars into the system for folks who really need it to exit homelessness quickly. And so just be really thoughtful when considering how to implement TH-RRH. I know it's a lot to think about. We'll talk more about it in an upcoming webinar.
So the next slide after this is a summary slide, but before we do that, unsurprisingly, we have a lot of questions about the TH-RRH component. So I'll just ask one sort of basic one, and there are a few questions that came in like this. Would you consider TH-RRH this quote-unquote bridge housing, which has been talked about a lot recently? Would you consider the TH-RRH joint component a bridge housing option?
Again, I can't speak for HUD, but I think that's a really useful way to consider it, especially if you have a lack of this capability. I know a lot of people, a lot of communities, it takes a little bit of time to get people into, to move into permanent housing through rapid rehousing, so this could be an excellent bridge housing option, yes.
Okay, great. So we'll answer more questions in just a minute. So if you have more questions, feel free to be entering those into the chat box now. But I'm just going to sort of sum up what we really want you to get from this, the last 44 minutes of this webinar. So COC should focus on outcomes that reduce homelessness. And you should be using data to determine what your community needs to reduce homelessness. You can use the tools that the Continuum of Care NOFA gives you. Those are review and rank, reallocation, to strategically accomplish your goals of reducing homelessness. And you should consider how decisions that you make align with your vision for ending homelessness in your community, the needs of people experiencing homelessness, and the effectiveness of projects as demonstrated by outcome data. So you can expect in the future a webinar on the TH-RRH joint component. We'll definitely have more analysis and information for you guys once we know more, when the actual NOFA is released. We do have a NOFA website, which I can send out in the chat box, that has a bunch of resources, but I've included 3 in the handout section of the webinar, so you can look at those now. So it looks like we still have a little bit of time, so let's look at some questions. And let's see. Okay, so here's one for you, Cynthia. So we said earlier that narrative responses weren't a good thing to be to be asking your projects to use when they're filling out their NOFA applications. Instead, you should be using data. But someone wants to know what your thoughts are on using narratives to explain, for instance, a domestic violence program who exits clients to homelessness situations for safety reasons. So is it okay to use narrative responses in that kind of situation?
Yeah, I mean, absolutely. There's, it's not that you should not use any narrative narrative questions or ask for narrative responses on your application. Then I'm sorry, that's a good question. So thank you for allowing me to clarify. It's useful sometimes to ask questions that allow people to explain, you know, certain things about their program, but you can always have in your project applications, you know, if there's anything else you want to tell us about why your outcomes are a certain way they are. I know with survivors of domestic violence, sometimes people are needing to stay in certain locations that are temporary for longer periods of time. For safety reasons, it's a really good, a really good possibility. So I think that there are different narrative questions you can ask, as long as you're also asking questions that include responses that require the projects to give you objective data. If you're doing both, that's okay.
So there's a question here about evaluating rapid rehousing, and one of the folks wants to know how, you know, do you have any recommendations for criteria they should be using to evaluate whether or not their rapid rehousing is effective?
Well, I'm glad that we do have a resource for you. We have on our website 2 resources that are dedicated really to evaluating rapid rehousing. One of them is the National Alliance Performance Benchmarks and Rapid Rehousing Standards. If you go to our Rapid Rehousing Know-How series, you can just either Google Rapid Rehousing Know-How series or go to our website and enter that into the search. You will come up there, a page will come up, and it's pretty easy to find them that way, and a lot of other rapid rehousing resources, or you can just Google Rapid Rehousing Standards. But there, in that document, we lay out performance benchmarks that you can use to evaluate your rapid rehousing programs, and all sorts of ways to use the data that you're already collecting to evaluate them. There is an accompanying document that is the Performance Improvement Toolkit for Rapid Rehousing, and that sort of goes into much more detail about how to use those performance benchmarks that are in the standards to take a look at your programs, and also kind of gives you a lot of options for how to improve them. So you might just see some new projects that need some help building their capacity, and this sort of allows you to figure out which data to look at and how to use that data to evaluate and improve those projects.
So we have a question from a community that feels not totally dissimilar from Arkham. They have a lot of permanent supportive housing and no transitional housing left. So they do have, you know, they have this problem where their portfolio of COC programs is, you know, almost entirely composed of permanent supportive housing. And they said it's, you know, it's easier for them to try and improve the existing permanent supportive housing than reallocating from one low performing or not as well performing PSH to another higher performing PSH. So what, in this kind of situation, what kind of advice would you give?
Anna, I'm sorry, you cut out just a little bit. I'm sorry to make you repeat that, or maybe you have a recommendation to give, or if you don't mind.
Yeah, sure. I mean, the question was about what if you have well-performing PSH in your COC portfolio and not a whole lot else. And I would say, you know, while you can reallocate from low-performing PSH to high-performing PSH, I think one thing we tried to communicate in this webinar is that reallocation is one of a few tools that you have to improve your projects, right? The review and rank process should be based on outcome data that rewards higher performing permanent supportive housing programs or any, you know, high performing program by ranking them higher, which should sort of bring the performance of all of your programs up, you know, but unfortunately we have a competitive process. You know, someone's always going to be in last place, but, you know, I don't think that you always have to reallocate something. Would you agree with that, Cynthia?
Yeah, I'd agree with all that. I know that a lot of COCs out there are in a difficult position because they have reallocated just about everything they think they can reallocate, and now you have a lot of high-performing projects, especially when it's PSH, and you don't want to lose that because there's people who are in those projects. One way that, this is a longer-term kind of way to think about things, and it's something Arkham could do too, is to create some move-on strategies from your PSH. So for the people who are in PSH that are really able to move on to something that's something like still permanent housing, of course, but they don't need the intensive services of permanent supportive housing anymore. A lot of communities are starting to work on these move-on strategies to connect people to permanent housing, vouchers perhaps for their folks in PSH to open up some of that PSH. And then you sort of see, well, do we have people to still put in that PSH? Or can we now start over time reallocating some of that funding to other project types or help some of the other folks in our community? Now, again, I know that this year you will have to do the tiering process, and that means that you're going to want to figure out, who to put in tier 2. But and that's, I don't have a good answer for that. But I agree with everything Anna said, and to think about this in sort of a longer-term strategy.
So we have a couple of questions about prioritizing clients for different interventions. We clearly stated in the Arkham example that our resources were mismatched to the needs, right? We had more individuals experiencing homelessness than families. But how do you, really institutionalize a policy of prioritizing people across populations at the COC level? Should you prioritize individuals over families, or should you look at things like vulnerability or chronically homeless or unsheltered homelessness for, and this is the folks who've been asking this question, two people asked this, both questions were about rapid rehousing. How do you prioritize people for rapid rehousing? Should it be population specific or vulnerabilities or both?
It's a tough question, and it's a really, really good question. And I think it should be both. I think, again, it really depends on what your community has in terms of resources and what your community has in terms of the people who are actually experiencing homelessness and what their needs are. Now, I know a lot of communities, because they're prioritizing people who are the most vulnerable through their coordinated entry system, it means that there are people who are kind of at the bottom of the list who aren't really getting up to the top. So how do we figure that out? Some communities are thinking through how to do set-asides for rapid rehousing. So, for example, I know we hear this from communities with domestic violence projects. They might not be sort of triggering sort of the higher vulnerability on some of the assessment tools, but they still need the housing resources. So can there be set-asides for those folks, but still have prioritization for the most vulnerable, or if we don't have enough permanent sort of housing projects, but we do have people who are chronically homeless, we want to prioritize them for rapid rehousing, but we want to make sure that we're able to get rapid rehousing to the other folks that need it. So it's a complicated question. This is really done through your COC written standards so that everybody is prioritized the same way, and through your coordinated entry system, that should all be aligned. But I would say that doing it, you might need to do it both ways, which I know isn't, again, that looking at your data, looking at what your needs are, and trying to figure out, well, how much do we need of what? Now, there are some communities that have done some modeling around this and try to sort of figure out what pathways people are taking in their communities and how that they can sort of start help that that can drive how they estimate what they need. And so if you're curious about some of those examples, please feel free to write us, and we'll try to provide some of those.
And I think that question is a great example of how this goes beyond, these decisions go beyond just the continuum of care NOFA application, right? We didn't discuss today, for example, homelessness diversion strategies that can help people avoid entering the homeless system entirely, which a lot of communities have implemented with success with both families and single adults. And so we didn't discuss if Arkham has a successful diversion program and how they're using that. So it's definitely just another example of how it's important to look at the bigger picture beyond just what the Continuum of Care program funds, at all of the resources available. So I think we have time for, go ahead.
I just want to say, Anna, that was an excellent point to make, because I think for a lot of communities, I often have this conversation with communities, which is that the COC has been squeezed for every drop that it has, and so you might have to really, and I know this is not easy, but to look at other funding in your community. Is there funding that can replace some of the permanent supportive housing funding? Is there funding that can be brought in to do more rapid rehousing? Or, how can you look at other dollars in your community in different ways to match things differently? Because I know a lot of you have just used the Continuum of Care dollars as the best ways you possibly can, and you need to sort of find capacity elsewhere, and maybe you can replace some of the funding that you have to reallocate here and find new ways to use your COC dollars. But it is a big picture analysis, and it really requires looking at your whole system.
So maybe as a last question before we wrap up, speaking of money, we'll talk about how to measure cost effectiveness. So this question is about how do you propose measuring cost effectiveness? Do you look at all funding or just COC funding for each program? How do you compare interventions between component types? And how can you compare dollars per successful outcome for families and individuals, or more or less vulnerable populations? So this is a big nuanced question, but maybe you can take a shot at how to get started measuring cost effectiveness.
Yes, so let me take a few of these one at a time. So cost effectiveness, there's a lot of different ways to do it. There's a sort of simple way of doing it where you're sort of taking your number of clients served, number of households served, and dividing that by the budget, and looking at sort of by the number of permanent housing exits and the budget, and you're looking to see, well, okay, how much does it cost per household per permanent housing exit? And so sometimes that can be one way to do it. Now, if you're just looking at a program's HUD budget, oftentimes they have other dollars in there, so that's why it's not, you can use just the HUD budget and compare that to other projects. It's more helpful to know what all the dollars a project is using to really know how cost effective it is, because it might just be like 25% of their dollars might be HUD dollars, and they might be, much more expensive per housing exit, but you can't see that if you don't see their whole budget. Now, you shouldn't, the best way, I think, or one way I would recommend to look at different component types is you want to look at permanent supportive housing compared to other permanent supportive housing, right? We're not necessarily comparing different component types in terms of how cost effective something is. So if we're looking at all the different permanent supportive housing for families, let's see what the cost per permanent housing, what the cost effectiveness, and sort of try to compare apples to apples. Now, sometimes you're looking at your whole system and saying, okay, well, let's look at, and that's for the review and rank process. When you're deciding what your system needs in general, you might say, okay, let's look at all the different interventions and what they cost, right? So we can see that transitional housing costs houses X amount of households for this amount of money, whereas rapid rehousing maybe houses this like a different amount of households for the same amount of money. So maybe they have the same outcomes, and we want to sort of reposition our dollars so we're able to serve more people. But when you're actually evaluating programs, you want to evaluate programs within their own type, right? So that you are not digging programs who are a completely different component types. And so the way to look at cost effectiveness, as I said, you can sort of do it in a few different ways, but you want to make sure you're doing it consistently across the component types. So you're looking at all the permanent supportive housing the same way. You can look at families versus individuals in a different way. It's really up to you and what you think is fair, and sort of what you have in your system. Now, some people ask, well, how do we evaluate projects that are new? It's just started up last year, or probably been under, and been only going for 6 months. You might look at them a little bit differently. So if there's a rapid rehousing project that's only been up and running for 6 months versus a rapid rehousing project that's been around for 10 years, or not 10 years, but however long, you might want to look at them a little bit differently and sort of not ding the new program for not having the best outcomes. So there's different ways to nuance your scoring tool so that it feels fair, and so that projects feel like they're sort of like being looked at in an even way.
And I'll also point out that we do have a handout that's on the right-hand side that talks about how to think about lots of different points to look at when you're considering reallocating permanent supportive housing, including cost effectiveness. So I recommend checking that out. So I think that's a wrap. Thank you all so much for participating in our webinar, and stay tuned for more NOFA resources from the Alliance.